So the transplant ineligible population tends to be older patients. Often there's no specific cut-off chronological age for transplant, but usually in terms of biological age, it's between the ages of 60 and 70, but it very much depends on the fitness of the patient. For those patients, there's a range of different therapies that could be offered depending on their fitness. So you may be able to offer a intensive approach for patients that are fitter and have a younger biological age. If they're not suitable for a very intensive chemotherapy-based approach, you could look at something such as a hypomethylating agent like azacitidine. We have a number of trials available for those patients. Unfortunately, azacitidine is not widely available for all patients with acute myeloid leukemia. It's only available for those patients that have a low blast count or myelodysplastic syndrome. So that gives us a real impetus to put these patients into clinical trials where they get access to these drugs. And for the much frailer patients, we could look at the low intensity 1 study, which is combining low dose chemotherapy, potentially with other small molecules or another small molecule on its own. But for some patients who are very elderly and very frail, sometimes the only option is best supportive care, where we support patients with transfusions and antibiotics and just try and manage their quality of life.